Are you over 40 and you notice your eyes aging more than the rest of your body? Maybe you need more light to read. Maybe you're holding your phone further away. Maybe everything looks a bit foggier than it used to be. I'm Dr. Michael Gartner, board-certified plastic surgeon and physician, and I'm over 60 years old. I've dealt with this myself. Today, I'm going to show you why your eyes age faster than the rest of your body and what you can actually do about it. But let me be very clear up front. I'm not going to promise you to throw away your glasses. Age-related visual changes are real and often permanent. What I'm going to show you is how to slow down the aging process, support your eye health, and potentially reduce how much your vision declines as you get older. Let's understand why this is actually happening. Your eyes have specialized cells called cones in the back of the retina. The retina is like wallpaper covering the entire back surface of your eyeball. These cones are responsible for seeing fine detail, color, and reading in the daylight. Here's what makes them unique. They're the most energy-intensive cells in your entire body. Each cone is packed with mitochondria, the energy powerhouses of the cells. When you're young, your cones have enormous mitochondrial density. As you age, you lose mitochondria in these cells. Fewer mitochondria means less energy production. Less energy means cones can't function as well. The result is you need more light to see, color looks less vibrant, the fine detail becomes harder to distinguish. By age 60, you need 3 times the amount of light to see compared to when you're 20. This isn't a disease, this is normal aging, but we can slow it down. There are 4 stages of visual decline that most people go through. Stage 1 usually happens in your 40s. This is contrast sensitivity decline. Your brain's ability to differentiate between light and darkness decreases. Night driving becomes harder. Reading in the dim light becomes difficult. This usually is the first thing people notice. Stage 2 happens in your late 40s to 50s. You start needing more light. Things you could read easily in natural light, now you need a lamp. This is when most people get reading glasses. Stage 3 happens in your 50s and 60s. You start seeing glare and fog. Headlights at night create halos. Driving in the rain or fog becomes genuinely more difficult. Stage 4 happens in your 60s and beyond. The macula, which is the central part of your retina, responsible for the sharp central vision, starts degenerating. This is called age-related macular degeneration. Fine detail becomes very difficult without visual aids. Here's what's important to understand. These changes happen to everyone. They're not entirely preventable, but the speed and severity are influenced by what you do starting today. Now let's talk about what accelerates eye aging. The first factor is high blood sugar. High blood sugar causes something called glycation. Sugar molecules permanently attach to proteins in your blood. Once sugar attaches, it doesn't come off. It stays there until that blood cell dies. Glycated proteins damage tiny blood vessels in your eyes. This reduces blood flow to your retina. Less blood flow means less oxygen and nutrients reaching those energy-hungry cones. The second factor is extended screen time. When you stare at a screen 2-3 feet away for hours, your eye muscles stay contracted. This is like holding up a bicep curl for 8 hours straight. The muscle that controls your lens gets fatigued and tight. Over time, this reduces your ability to focus at different distances. Screen time also dramatically reduces your blink rate. Most people blink 15 to 20 times per minute normally. At a computer, that drops to 5 to 7 times per minute. The third factor is oxidative stress. Your eyes are constantly exposed to light and oxygen. Without adequate antioxidant protection, mitochondria degrade faster and the aging spiral accelerates. Now let's talk about what actually helps. There are 3 most important things you can do. The first strategy is supporting your mitochondria. Remember, the core problem is mitochondrial loss in your retinal cones. You can't completely prevent this, but you can slow it down significantly. The first thing to do is controlling blood sugar aggressively. This is non-negotiable for eye health. Cut refined carbohydrates and added sugars. Focus on whole foods, adequate protein, and healthy fats. The second way is exercising regularly. Even your retinal cells benefit from improved circulation and signaling. Aim for 30 minutes of moderate activity most days. The third is prioritizing sleep. Your eyes repair themselves during sleep. Mitochondria undergo maintenance during rest periods. Chronic sleep deprivation accelerates mitochondrial damage. These three things create the foundation. Without this foundation, nothing else matters. The second strategy is getting the right nutrients. The first nutrient is vitamin A. Vitamin A is essential for the photoreceptor cells in your retina. Deficiency causes night blindness. But here's the catch. Many people have genetic variants that make converting plant-based beta-carotene into usable vitamin A difficult. You need preformed vitamin A from animal sources. The best sources are egg yolks, which are highly bioavailable. Liver is the most concentrated source. 2 to 3 ounces once a week is plenty. The second nutrition is lutein and zeaxanthin. These are carotenoids that concentrate specifically in your macula. They act as antioxidants protecting against oxidative damage. They also filter harmful blue light before it damages your photoreceptors. Eat eggs and greens for maximum benefit. Third nutrient is vitamin D. Vitamin D receptors exist throughout your retina. Low vitamin D is associated with increased risk of age-related macular degeneration. Most people are deficient. Get your blood tested. Your target should be between 50 and 70 nanograms per milliliter. The third strategy is the 20-20 rule. The protocol is simple. Every 20 minutes, while working at a screen, look at something 20 feet away. Hold your focus for 20 seconds. While focusing, deliberately blink every 5 seconds. Set a timer on your phone if you need reminders. Here's why this works. It breaks the accommodation reflex that keeps your eye muscles contracted. It forces complete blinking, which lubricate your eyes. It gives your visual system a micro rest, and it reduces digital eye strain significantly. Everything I've shared today supports eye health, but it doesn't replace medical care. See an eye doctor immediately if you experience sudden visual loss, significant visual changes. If you see flashes of light or a sudden increase in floaters, this could indicate retinal detachment. Eye pain is an emergency. If one eye is suddenly much worse than the other, get checked immediately. If you have difficulty reading, even with your current glasses, you need an exam. Regular eye exams are essential. Get annual exams after age 60. Age-related vision decline is real, but how fast it happens and how severe it becomes is partly within your control. Stay with these strategies today and give your eyes the support they need. Here's to looking better and living longer.